Hello, welcome back to TCOMM-MONDAY. My name is Dr. Nicola Felton, and I'm very excited to be here today. There's a couple things I want to cover before we get started on our topic, which is why you shouldn't ignore negative and unwanted behaviors in children. That's our topic. So the couple things I wanted to cover, I wanted to give you just a quick peek at the Color of Me movement workbook, and just kind of remind everyone, if you don't have a copy of this workbook, then I want to go ahead and share the information that's in the back of the book. Talks a little bit about what is coming up, like our scheduled releases. Right there, you see them, but I'll go ahead and read them to you. So the end of July, what we're going to be covering is OCD, Obsessive Compulsive Disorder in Children, the Self-Help Workbook and the Journal, as well as Food Aversion. And the Food Aversion, Self-Help Workbook and Journal will also cover some significant aspects of eating disorders. Very excited about that. So what we normally do, we recommend that treatment professionals and parents gain a lot of information from the guidebook itself, and it kind of teaches you how to actually work through and pace yourselves through the workbooks and the journals. Okay, the workbooks and journals are designed, one, to be used by parents and caregivers, as well as individuals who are struggling with these disorders as well. I think they're very easy and simple for children as young as 12, 13, even some more advanced as young as 11, to be able to use them all the way through adulthood. Now, the workbooks themselves had a lot of significant information in there. You'll notice that we do have what we call colorings, right? And I think when we first did our pilot for this, I talked about the coloring. I developed a coloring for each behavior disorder that we're going to be working with. And the first two we did were on autism and ADHD. And so this is the autism coloring. So you see a lot of colors there. A lot of the colors that are significant when we're talking with children with autism as well as Asperger's syndrome are a lot of pastel colors. So you'll see that. And, you know, we go through each and every last one of the colors in here and tells you which one are going to be good and where you can find colors like that. Like if we were given an example of green and use a certain color of green when working with our children that are struggling with behavior and emotional aspects of autism or ADHD, then it tells you where to go. Like green, of course, would be in nature, and then it tells you how you can apply that color in your in the child's personal space as well as other aspects of your home. So that is just a little bit, you know, about that, so you get an idea of what's coming up next time. So if we have parents and caregivers and treatment professionals that are tuning in and getting a little bit more of the basic information and want to know, you know, when are we going to have other books that are going to be coming out, and so that's going to be the schedule. You can also go to the website, thecolorofmemovement.com, and it also gives you the schedule there for which books are going to be coming out next. And so all of the disorders that we're going to be covering over this entire series, because when we talk about anxiety and depression as well, Tourette's syndrome, ODD, oppositional defiant disorder, and giftedness with ADHD and OCD behaviors as well. But when you take a look at the guidebook itself, the guidebook goes over each and every last one of the disorders and the aspects of them that we'll actually cover as we go through the series. And then every 3 to 4 months, and pretty much once a quarter, we'll come out with the books that we're going to cover, the workbooks and the journals. So there you have it. So now what we're going to move on, we're going to talk about our topic for the week. And the topic for the week is why we should not ignore behavior and emotional disorders in our children. And there are a lot of reasons why we should not ignore behavior and emotion disorders in our children. And some of the significant and top things that we really have to talk about is, at least that I want to be able to share with you today, is that if we ignore the behavior and emotion disorders in our children, the things that are stressing them out, that are overwhelming to them, that are causing anxiety and disruption in their lives, as well as your lives and the children's siblings' lives and other people that are involved in your family, what do you think is going to happen? Right? If we minimize it, if we ignore them, they're going to get worse. We're not going to learn how to work through them. Children will not learn how to work through them. They will not learn how to modify their unwanted behaviors. They will be anxious and overwhelmed. It will carry on through adulthood. And now you have an adult that you no longer have any type of ability to be able to speak to someone that their behaviors may have caused them to have something negative reflect back on them. As an adult, you do not have the right or ability to jump in there and try to explain what's going on with your child. You will simply have to remember and reflect back when you knew that there was a problem and you ignored it or you minimized it. And you realize you haven't actually taught your child how to work through those behavior and emotion disorders as children, and they simply become worse. And the individual, which is your child in this case, become agitated and overwhelmed and probably come up and develop some negative ways to work through their feelings and their emotions that will not be beneficial to the outcome and the overall picture. So one thing that I want to share with you is I'm coming to you every week and I'm talking about different aspects of behavior and emotion disorders and things that parents should be able to do or should learn how to do or be beneficial for them to learn how to do, because you can work through those however you want. But what's important is for us to realize what we're trying to do is make life better for our children, to teach them how to modify their behaviors, to work through negative and unwanted behaviors, as well as teaching them how to reach out and ask for help when they're anxious and overwhelmed because of behaviors they cannot or they have not actually understood or learned how to modify. So that's one reason why you're coming every week. So I want you to keep the information coming to me. I received 2 requests this week that wanted to know what happens if I ignore this behavior, or in a sense just don't want to think about it being something that's negative. So I'm asking, what do you mean by that? Well, the feedback that I received was, what if this behavior is a result of age, going through puberty, and that is something that's going to go away? And parents have shared with me that if they, make a big deal about it, or they try to say, oh, it's time to go and speak with the mental health professional, or let me journal and write down what's going on with you because I don't want to miss anything, then children start to think that there's a problem with them. And then the month later, 2 months later, 3 months later, you realize that they were simply going through a phase. Well, I think that parents will be able to observe their children and kind of notice and understand whether or not their child is actually going through a phase, or if this is some behavior that's actually truly disruptive to their lives and what they want and what they need, what they hope to gain out of modifying some of that negative behavior. So I'm going to go back to the workbook for a second here, just a little bit. And there's in the beginning, I guess, of each of these sections, I have written either a short story or a short poem, speaking from the voice of the child, that tells a little bit about how they feel or what they think about their emotions and so forth, and something that they would say to their parents in a situation where the parents are not really recognizing that they have some type of behavior that may need modifying. So we have a child here with autism, and the child is saying to their parent, or they're trying to say to their parents, that they are sorry. So, I'm so sorry. I'm so sorry that you don't understand me. I'm sorry that I can't focus. I am sorry that I cannot stop my thoughts. I'm sorry that I make you repeat yourself. And I'm sorry that I'm sorry. But I'm having a hard time taking a look at myself. Can you look at me? Do you see me, the real me? Can you understand my struggle and help me make decisions? Because I'm sorry. I'm so sorry. And I'm even more sorry that I'm sorry. Today, I'm looking for hope. I found hope. I have no idea where it has been, but it was in front of me this morning, and I found it. I found it when you looked at me, when you asked me how I was feeling, what was going on inside of me, what was causing me pain. I didn't know how to respond to you, but I found hope, knowing that you were listening to me, that you were paying me some attention. I know I just need to learn some new techniques, some different ways of dealing with my feelings and my emotions, some different ways of communicating what's driving me crazy sometimes. I feel crazy. No, I don't think that I'm crazy. And you don't teach me to think that way about myself, nor do you treat me that you feel that way about myself. But when I'm confused and I don't understand things, and you're not reaching out and talking to me, I feel crazy. And I'm sorry that I feel that way. And I'm sorry that I'm sorry about feeling that way. I want to move to the beat of my own drum. I'm sorry that I didn't know how to share my thoughts and feelings with you. I thought that you would ask me. I thought that you would reach out and say to me that you see something different. See, when I wasn't able to verbalize my feelings to you, I thought you would see the difference in my behavior and you would reach in. So I'm reaching out now because you have asked me how I am doing today. So I'm no longer sorry. I'm hopeful. So that's just, part of one of the poems that's written in there, in thinking about your child and their struggles. Because I think one of the main aspects of that is understanding that children are not always able to say, I got a problem. I'm overwhelmed. I'm anxious. Sometimes the behaviors that they are displaying, what you see, is their way of communicating what's going on inside. That something is wrong. They are anxious. They are overwhelmed. They're on edge. They can't communicate their feelings. And some children can. And they do it in a form of yelling and screaming, but they make sure you get the message. And some children, they just have different behaviors. Sometimes that behavior is not really loud enough for us to hear it. Sometimes they become nonverbal, and they're not sharing their thoughts and feelings at all, and they become withdrawn. And they, I guess, in all appearances, we will say, oh, they're very, very shy. Well, they haven't always been shy, but all of a sudden as teenagers, they are shy. It is important for us to really be able to look at our children and identify when they have behaviors that have changed, behaviors that are causing them not to feel comfortable in their own skin, things that we really truly have to pay attention to. So the workbook, good book, a lot of great information in here. You're allowed an opportunity to take chapter notes as well, to add any additional information in there, because you want to be able to transfer that information that you have in the guidebook over to the journals and the workbooks, and just kind of gather information together to put together to be able to share to any treatment team member or any mental health professional. So let's go back to ignoring behavior and emotions in our children and why it is not a good idea to do that. So jumped around a little bit, but we definitely talked about if we ignore it, minimize it, then our children are not learning how to work through their negative thoughts and feelings or work through their behaviors. And they get to a point as adults where we're not able to jump in there and rescue them or give them feedback. One, because they're adults, they don't have to listen. Two, because they're adults, other people don't have to listen to us as well. And so we want to teach them how to do that. It gives us an opportunity to allow for a sense of normalcy in our lives and in our children's lives. And this is not normalizing their behavior, but getting their behavior to a point where it's more manageable, that we establish a good level of sense of normalcy in our own family, knowing that all children or all families are different. So whatever and however you just define normalcy in your family without normalizing negative behavior is going to be something that's going to be truly beneficial for you and your child and your family as a whole. So I want to take a look at the ADHD journal a little bit right here. And all of the journals will have information in there that's going to be specific to that disorder. But what I want to talk about here is when you're looking at your journal, I talked about in the past question prompts. And so I'm going to read a little bit here. When you get to the point where you're like, well, I don't know if I'm minimizing behavior. I don't know if I'm overlooking negative behavior or not. And so your journals, these are daily journals. Every day, you get your question prompts and they're all different. And one of the things here I'm going to read to you says, are there areas in my home that my child seems to be more comfortable? Are they more comfortable in their own personal space? Are they more comfortable in the kitchen? Are they more comfortable in different rooms? And then allow you an opportunity where your workbook will come in is to determine whether or not there's a specific color in there that either may be overstimulating your child, or a color that may be helping to calm your child. And that's why the workbooks talk to you a little bit about the coloring. And so you can get into what's going to be the best color to help bring about good behaviors and modify certain behaviors on one of the behaviors that we want. Another thing is, as we talked a little bit about autism and what the child is saying, saying they're sorry that they have these negative emotions and the negative feelings and outbursts, to help you understand and kind of look at, whether or not these are things that you need to pay more attention to, or things that you need to move on. We don't have to worry about that because that's not debilitating, to their daily lives. But I want you to be able to, read some questions that's going to trigger some thoughts in your mind. And one of those things are like, am I a good listener? And be able to ask yourself, am I a good listener to my child's behavior and emotions? That means sometimes we have children that cannot express themselves verbally, so they can't necessarily speak out and says, okay, mom, I'm overwhelmed today and I need some help. They may be expressing themselves in actions, and they may be throwing things, and they may be sitting, in a corner all huddled up and not sharing their thoughts and feelings. That's being a good listener as well. Observing their behavior is part of your listening skills. You need to be able to pay attention to their body language, because their body language is speaking something to you. So another question you can ask yourself that is shared in the book is, can my child actually share their thoughts and feelings? And if they can, is it verbal? Is it unverbal? Verbal or nonverbal? How are they actually displaying their thoughts and feelings? Can they communicate how they think or what they're feeling to me, right? You want to be able to know that. Is your child able to talk about their feelings? Mental health professionals. Perhaps sometimes you actually have your child seeing a mental health professional, and you're trying to make sure that mental health professional is communicating things to you. where perhaps they have shared things to you, their thoughts and their feelings about what's going on, but you're not really listening or paying attention because you don't see those things at home. I think it's important for us as parents and caregivers to be mindful of others who are observing our children as well. So best friends, may say, I don't know, he was acting differently or she was acting differently today. The teacher may tell you your child was acting differently today. The bus driver may tell you your child's acting differently today. A peer or another family member or a sibling may say, this is what was going on today. I think it's kind of odd. So pay attention to all those things, even though you may not physically be able to observe it in the moment. If you pay attention to what feedback others are giving you, that's part of being a good listener. Then you can determine whether or not it really is something that's happening at home. Maybe something else is more overwhelming or overshadowing that, so you may have missed it. So you want to be able to gather up as much information as you can and feedback from others, and not necessarily saying this person's telling you what to do with your child, but this is behavior that I observed. I think maybe you might want to take a note of it. Extremely important to be able to do. So other questions that have come up in your journal says, am I able to have a healthy conversation with my child? Can you sit down and talk to them about their feelings and their thoughts? What's going on? Can you talk to them about behavior that you're observing or maybe behavior that others have observed, and ask them if something is going on that you feel as though, that they need to discuss, or they feel as though they need to discuss. Very, very important. There's also an opportunity in your journals to take your daily notes. And so after you've actually talked about things with your child, or observed things, or taken down information about things that you observed or others have shared with you that they've observed, then you get an opportunity to journal later about other things that could be going on, whether things are going on with you or things going on with other family members, or anyone that your child is around that they may be influenced by, whether negatively or positively. And obviously we want to definitely write down the positive things that are going on as well, because you want to let your child know the tremendous growth that they're having and how well they're doing and improving on a daily basis. So it's very, very important. So get back to, the topic is why you don't want to ignore that behavior. Why? Because we don't want to minimize what is important for us to pay attention to in order for us to be able to help our child. Pay attention to your child. Listen to them when they have things they want to share with you, and listen to them when they are nonverbal and they're sharing things out in their behavior and their actions. Okay? So again, continue to send me your messages. Let me know what you want to hear more about. Thank you for joining me on TCOMM Monday, and I will see you next week.